This is Dr. Chappuis from Spine Center Atlanta, and we're here today to talk about alternatives to back fusions. I know we did a video not long ago, do I need a back fusion? There's a lot of alternatives. First of all, though, do I need a back operation? Certainly as a spine surgeon, orthopedic surgeon, we want to make sure that you've had every opportunity for conservative care. What's conservative care? Well, we start with the physical therapy, chiropractic care, activity modification, weight loss. If those things don't work, then there are different types of injections that can be helpful. Again, still within the realm of conservative care. What happens after all those are tried and you're not getting better? Well, the last that we have a hard time with is called the tincture of time. Many times these pains and certain things like that will improve with time. But if you've given it time, you've tried all the other conservative treatment options, and your pain now is affecting the things you need to do and the things you want to do, and you're willing to consider an operation, then that's kind of where we want to start this video. From the least invasive to the most invasive, it's becoming more and more popular. It's called endoscopic spine surgery. And this is surgery done similar to where you have arthroscopy of your knee. Now there's a whole type of surgery that can be done through an endoscope percutaneously. So that's one option if you're having pain. But I think as an aside, in order to determine the best operation, we have to find out where your pain's coming from. We call that a pain generator. A lot of times it's not just one source. And when I ask a lot of my patients, are you having back pain, leg pain, or both? If it's primarily leg pain, then the operation of choice would be to find out why. It's either a disc herniation, narrowing where the nerve comes out from either arthritis of your facet joint, hypertrophy of your ligamentum flavum, whatever. It's causing narrowing where your nerve comes out. So if that's the case, the best operation will be what's called a foraminotomy. And that can be done either through a little open limited incision, it can be done through a tube, it can be done through the endoscope that we just talked about. What if you have back and leg pain? Well, then usually there's more that may need to be done. Again, the question is, where's your back pain coming from? And once that's determined, then the best operation can be recommended to you. Now, the fusion is something that's always there, it's always available, but many times, in my opinion, that's a little more than is necessary. So what if I don't want a fusion? Well, we do the decompression that we talked about, and decompression just means we're opening the nerve to give it room to breathe. And that can be done through a foraminotomy, which means we're opening the foramen where the nerve comes out. Laminotomy, which means we're opening the lamina to give the nerve in the end of the spinal cord more room to breathe. Then once that's done, is there anything more that needs to be done? And many times, in my opinion, the answer is no. In fact, there was a recent study that came out that looked at decompression versus decompression and fusion for degenerative spinal stenosis. And actually, the decompression alone did much better than the decompression and fusion. Now, I'm not against fusions. Many times they're necessary, and if they are, they're really a good operation. But I think there are other alternatives. Well, what if you've got back pain, you don't want a fusion, the decompression you had didn't work? Are there any other options? Well, there is. Over the past 20, 25 years, total disc replacements have come on the market. They started off in the lumbar spine and the cervical spine, and I would say it's standard of care now for problems in the neck or cervical spine. It's also becoming standard of care in the lumbar spine. So what does this do? Well, it's just like if you have arthritis of your knee, as opposed to fusing your knee, which probably in the early 40s and 50s, that's what would happen. If you had arthritis of the knee or hip, fusions were done, hip fusions and knee fusions. It took the pain away, but it also took your motion away. Well, in the 60s, Sir John Charnley developed the total hip replacement, and so we don't even think about fusing a hip anymore, fusing a knee. Of course, we want to do motion preservation through hip replacement or knee replacement. Well, that can also be done in the spine. And again, you have to be the right candidate for that. Your surgeon will review your MRI, your x-rays, your imaging studies, your symptoms, physical exam, and then can make that recommendation for you. Sometimes it may be worthwhile to get a second or a third opinion. There's so many different types of techniques for operating on the spine that if one surgeon doesn't give you exactly what you feel comfortable with, then there's nothing wrong with asking for another opinion. In fact, many times I'll encourage our patients to get another opinion, especially if it's a complex type problem. So in summary, back surgery only after all the conservative measures have failed and your pain is so severe it's affecting what you want to do and what you need to do. Now again, there are absolute indications for surgery, which is progressive neurologic weakness or deficit, bowel or bladder problems, or what we're talking about now is pain which is refractory to conservative care. So once we're in that realm, then what's the best operation? And as we mentioned, a lot of it depends on your clinical symptoms, not just your imaging studies. For my patients, especially with degenerative spinal stenosis, I don't base the surgery I'm going to recommend on the MRIs. I base it on their clinical symptoms and the MRI. If you're about to consider a spine operation, a back operation, make sure your surgeon is talking to you about where the pain generator is. Where is your pain coming from? And how does the operation he or she is recommending to you going to solve that problem? Thank you.